A lot of people will come in with knee pain and it's almost never the same. Is your knee pain under the kneecap, to the side of the knee, on the inside of the knee, the back of the knee, above the knee? All of those areas are going to be treated differently by a Rossiter coach. So we don't zoom in on any one area. We're looking at the entire leg. How are your hips balanced? Do you have something that's not working very well above the knee or below the knee?
We often fear what's going on with the ligaments, if there's been damage there, like you hear about football players having, an ACL tear or something like that. That's worst case scenario, and that's a real thing. What people usually feel as a knee problem isn't actually a knee problem, but a calf problem. They'll have knee pain, that's the symptom, but the real problem is actually coming from the calf. So what happens is you have a relationship in your leg, in the joint of the knee, between the calf, which is underneath at the bottom of the leg, and the hamstring coming from above. And they form this dynamic between them where the knee works well when everything's in harmony. But as the calf gets too tight and it starts pulling down, and if the hamstring is tight as well, then things get shortened up and compromised and can get locked. And that pressure from both sides just adds kind of fuel for the fire. So it gets tighter over time. The tighter the calf gets, the worse the knee pain gets. Sometimes the more the pain there is, the less we move. And the less we move, it just becomes a repeating cycle. So that's how knee pain often is created and sometimes sustained for a long time without a solution, when we don't know that it's not the knee itself and the ligaments, but rather the musculature and the connective tissue of calves and hamstrings and even quadriceps.